Welcome to Caring for the Vulnerable. NUR 3678, Session 1A. We think about vulnerable populations. We as nurses are very familiar with this group, as patients are admitted to our care, and many times they are very vulnerable. So let's look and see what this concept means. In 2008, Duchesne used the concept susceptibility to vulnerability. The two key concepts that must be examined then would be describing populations at risk, so vulnerability as well as vulnerable. That is, when patients come into the hospital setting, their vulnerability is increased. And then according to Adey, vulnerable are populations at risk for poor health, be physical, psychosocial, psychological, or psychosocial. So therefore, you have to think of two levels, individual or an aggregate. So when that individual is admitted, they become vulnerable. And then if you think about an aggregate, that is all patients as a group become vulnerable also, or their vulnerability is increased once they're admitted. In addition to that, Anderson and others state that vulnerable populations are social groups who experience health disparities as a result of a lack of resources and increased exposure to risk. So let's look at some of those populations. They could be many, which could be maybe alcoholics, ethnic minorities, immigrants, the poor, children, women, or elderly, can be homeless, those that are unemployed, those that are handicapped, those with social diversities, smokers, and those without food or clean water can become vulnerable populations. So what contributes to this vulnerability of others? Flashwood stated that people of color contributes to their vulnerability. People that are poor, marginalized by sexual preferences, immigrants, depending on your religion, can be vulnerable. One can be vulnerable. So one's vulnerability may increase based on some of these contributing factors. In addition, these groups may also include those high-risk mothers and children, non-English speaking individuals, people with AIDS, and therefore and homeless families. So these are things that you need to think about, these contributors. So then you wonder, when you delve a little further, you realize that what makes them vulnerable, or what keeps them in that status, is the fact that there are health disparities found. The health disparities are found in their infant mortality. In this group of population, their infant mortality rates are high. The cancer screening is very low. The cardiovascular diseases are high. Those with diabetes will be high. HIV and AIDS in this health disparity group will be also high. Immunizations low. Alcohol and substance abuse, because of that, their health disparities will also be high, and mental illnesses. So then what is the justice? How do we fit in as nurses with that understanding the vulnerable and vulnerable populations? We state that nursing is about working to eliminate the underlying structural causes which cause a high incidence of illness and disease among the poor. After all, nursing is in the business of people, getting people better. So we have to work to try to eliminate these structural causes which create these health disparities. So what are the concepts of justice that we must be faced? Duchesne describes the concepts of justice that fit with nurses' characteristics, which are fairness. We want to make sure that no one is deserted. We feel that everyone is entitled to care. We feel that justice is as a virtue, and we feel that everyone should be able to have good. So that, in other words, there should be advancement for good for all. In addition, some other concepts, Barnes states that we include how we relate to each other really does begin. So how we relate to each other, regardless of our race, creed, or color, really does make a statement. What are the basic human rights? That we really want everyone to be treated correctly and equally. We want to have public forum We want to have policies that are fair and just, and therefore how we can practice correctly, because we feel that's the way practice should be conducted. Barnes mentioned a concept called autokonokni, which really does mean that there's an ability to make autonomous decisions from the patients, regardless of what our views might be. Whatever that patient's decision is, it must be respected. So therefore, there's a web of interpersonal relationship that is woven between the nurse and the patient. In addition to that, Barnes states that the evolution of nursing is intertwined with this social justice. And you really have to think about that. We're really special people because values and our virtues of caring for the whole person is almost embedded, I would say. And then there's an imperative to work for social change. So you think about the nursing practice implications. This implication has to be directly related to talents and motivation of individual nurses. Because in our hearts, we believe that everyone should be treated equally. There's social practice with impact beyond individuals. There's adaptation of patterns of thought and actions. And we must understand global perspectives of the profession. And we must always start with understanding who we are before we can go out and decide what we're going to do for others.